Good afternoon, everybody. I'm Rainer Blaschik from the Institute of Transfusion Medicine, Transplant Engineering, and I have the pleasure to welcome you to this very special lecture from a very special, famous guest. Thank you very much. The topic is shortage of organs, actually, and how to combat that problem. You know, we had in January 2020, we had the chance to turn the time. We had the chance to introduce the opt-out solution in Germany, but it was January 16th. I very well remember that day. It was rejected. It was not approved by the parliament. The Green Party and the right wings were completely against it, and it had no chance to come through, and we got the informed consent solution, which didn't change anything. Maybe it changed something, but in the opposite direction. So we would like to learn from you, how did you manage that in Spain? Because Spain is the country with the most donors. I mean, you have DBD and DCD. We don't have DCD, of course. I mean, most of things related to transplantation are forbidden in Germany. We all know that. We have to face that problem every day. Maybe we can learn from you, and we can get into a solution over the time. I mean, just the Pro-Transplant Alliance sent a letter to the Ministry of Health. I co-signed that letter, where we asked again for reconsidering opt-out solution, because we consider that the only solution which will work, and I consider that the most ethical solution, because many opponents to the opt-out solution argue that this would be unethical. It would be a kind of body robbery, things like that. But the current solution we have is, from my point, the most unethical solution, because we force people into living donation, and we force physicians to transplant suboptimal organs. That can't be ethical. And we force people to move abroad to get a transplant, which is also not ethical. And I mean, on a daily basis, I have to disapprove living donations. All transplants go through my institute because of compatibility. I have to disapprove it because of donor-specific antibodies, which result from very highly mismatched living transplantation. And we don't have in Germany, of course, crossover transplantation. Maybe you can address that as well. Crossover would be a way out to have these highly mismatched living donations or transplantations. But this would be an ethical solution for the unethical solution, not having an opt-out system. But that is, of course, forbidden in Germany. So, before I leave you the micro, I was asked to present how good Hannover Medical School is in transplantation. You know, Hannover Medical School is the largest transplant center in Germany, not in the world, but in Germany, in Europe also, in many transplant programs. And I just want to give you a few numbers. That way, yeah, Rainer Blaschik. I should use this laser pointer. You asked me to do that. Yeah. Okay, so we have meanwhile transplanted 15,482 organs, which is really a very impressive number, and most of them are kidneys, of course, but liver and lungs are also a big thing in Hanover. We are one of the largest lung transplant centers in the world, I think. Is that true? Yeah. Yes. Okay. What are the numbers at MRH? We have these are the numbers by months. Total, we had last year 314, and the year before 337. So it is a decline. We have here the numbers by organs, and you see our heart transplant program is not the biggest in Germany. The largest center for heart transplantation is in Bad Oeynhausen. Yeah. How many do they? 100? 70, 90. So the largest transplant center for heart transplantation is doing 90. Lungs is 80. We already had numbers above 100, as far as I remember. Liver is actually we are one of the biggest centers, Berlin, Essen, Hanover, largest liver transplant center. Kidney is a big thing, but many of them are living donations. I already mentioned the problem related to that. Pancreas is a small program everywhere, and so 314. These are the numbers by months. I mean, there's no significant number for any month or any of the months. So these are showing the living transplantation numbers, which is a little bit decreased, but it's around 10% of all. And I mean, most of them are kidney transplants, or all of them are kidney transplants. Not all. Is there a living liver transplant here in Hanover last year? I can't believe that. In children? Ah, okay. So most of them are kidneys, some are livers, and it is then considering, compared to all organs, it is around 10%, but compared to kidney transplantation, it's 20% at least, 20–25% what is a living donation. These are the numbers of this year, and you see it's as dramatic as last year. This is by organs. I mean, we have a big increase in liver transplantation. What is the reason for that? None? Okay. We don't know yet, which is good. But we have a decrease in kidneys, so which is bad. Waiting list is big, especially in kidney transplantation. The waiting list is increasing, of course. In the other organs, it's not that much increasing because patients die on the waiting list. That is not what we want, of course. Transplant donation numbers in Germany. Yeah, I mean, what you see at Hannover Medical School, it's just mirroring what is happening in Germany. We have a decrease in the transplanted organs. I mean, we never had much. I mean, compared to Spain, it's ridiculous, even years before, and now it's even less. And of course, the organs from deceased donors it did decrease as well, because we don't have DCD. I mean, we have initiated a discussion. DCD donation should be something to consider. In Spain, as far as I know, it's 1/4 of the donated organs, isn't it? Okay. So what is organ donation Germany 22 variation? I mean, there is a plus in heart transplantation, which is probably not significant. Significant is the minus in lung transplantation, I guess, and in all the other organs as well. So there is a need to have a change